Right. So for next concept in orthopedics we should be looking at is what is known as a maternal request cesarean section. Maternal request cesarean section. So for maternal request cesarean section, it's usually abbreviated as what? MRC, or you can still call it what? CDMR. Alright, that's cesarean delivery on maternal request. So a cesarean section actually went on, but is the mother that actually what said, no, I don't want to actually deliver through the vagina, I want to deliver through what? Cesarean section. So for this one, is when a pregnant person elects to have a cesarean section for many reasons. Do you understand? So without a medical indication, so the woman could actually deliver through the vagina if she wanted, but she's the one that actually what asked for the cesarean section. So it's just based solely on the person's preference. The choice is increasingly recognized as part of the reproductive autonomy. Do you understand? So it's a reproductive autonomy. It's a reproductive autonomy. Once she says yes to what? Once she says yes to cesarean section, you can't deny her. All right, it's her body. Right. So why some people will always request for cesarean section just include things like she's afraid of what? Labor pain. Maybe she had previous birth experiences that were not nice. Okay, maybe there's a desire for what? Control over timing and what? Circumstances. Maybe concerns about pelvic floor damage or sexual function. All right, she wants to still be active sexually. Mental health conditions, then cultural or social influence. So ethical and clinical consideration, you have to respect what the patient's autonomy. All right, cesarean it carries higher risks of infection, hemorrhage. So you basically explain all the benefits and what disadvantages to the patient. Make sure that they understand everything before they are making that decision. So vaginal birth is generally safe, okay, for pregnancies that it can go with. So providers must what? Ensure informed decision making. So as they are making that decision, make sure that they know everything that has to go around it. So for trends in the USA, it's estimated about 2.5% of births. In Brazil, the rate is even exceeding more than 50%. That means in Brazil, women prefer cesarean section. So rates vary depending on region and depending on the type of healthcare system that is available there. Okay, so that was what the maternal request cesarean section simply means as a concept.